took us up until 2008 before we passed a bill as simple as saying you couldn't discriminate against a physical illness, simple as mental illness, and that we had to take science that we knew that was as clear as looking at a PET scan, fMRI, and say that you had to look at that and wipe away the bigotry and stigma that we allowed insurance companies to prey upon and say no longer could you permit that to continue as a matter of law by charging higher deductibles and co-pays when discriminating against those with mental illness. But in spite of that, of course, this bill is not a full parity bill. We have it in name, but in terms of function, we still have a long ways to go. We still have medical necessity determinations, as we do in our regular healthcare system, that leave many people with mental illness by the wayside. And until we get a patient's bill of rights, especially for those with mental illness, we are not going to be there. Until we have physicians and providers be the last ones to determine what's in the best interest of their patient, instead of insurance bureaucrats, we're not going to be where we need to be in terms of making sure that people who need these resources and treatments get what they so well deserve based upon what their physicians determine they need. Instead of that, we have today, unfortunately, a case where too often insurance bureaucrats call the shots. So we have a battle ahead, and we need to keep fighting that. I would ask you today to join me in that fight. We need to regroup and fight a new day. And this year, we're going to take that fight on in the form of a Patient's Bill of Rights battle as a catalyst, because it's pretty easy for us to use this as a political catalyst. Most people in the country understand that a provider should be the one that makes these decisions, not an insurance bureaucrat. So it makes it a pretty good, easy political fight. And for political reasons, this is the reason why we've chosen this as one of our battlefields to fight this battle on. And another reason is that we need to get people, obviously, to talk about this and their own struggles and to get active politically. Obviously, you keep asking yourselves, how could an illness which affects so many Americans go so unattended in Congress? Well, the reason is simple. Most people who are affected by this illness and their families aren't speaking up about it. And they're not holding their members of Congress accountable. And they aren't lobbying the Congress, they're not petitioning for redress, and they're not getting politically active. And so there can be every scientist, every brainiac in the world, every, research and statistician like all of you, telling us what we need to know, and we can be staring at it up on Capitol Hill, and we can know what is right thing to do. And still we can be stumbling all over ourselves and underfunding drug courts, and underfunding brief intervention, screening and support and treatment, and underfunding doctor education when we know that's the way to go for the best and possible prevention in terms of getting the best and possible results in this battle. But the fact of the matter is, none of this is going to happen until we get an educated Congress. And none of that's going to happen until we get an educated public. And that's going to only take place when we get people more open about speaking about their illness, and we clear the cobwebs of stigma and stereotype. And what that will require is for us to end this notion that anonymity means you got to shut up and be quiet and not go up to your legislature and talk about your recovery and what it's meant to your life.